Hey, my name's Dr. Louis Mariuso. I've been doing dentistry for over 7 years now, and I'm located in Knoxville, Tennessee. An arch in dentistry typically refers to either the top or the bottom. So the lower jaw or the upper jaw. That's arch is the word for that. So what you put in an arch can vary, and there's several different methodologies to treat that. You can have an upper arch, and it's just a traditional denture, a set of teeth that are made out of acrylic that stays in there by suction, whether it's adhesive or you've just managed to learn how to live life with that. It's a prosthetic. We also talk about arches in terms of implant treatments. So we have things like a snap-in full arch, which is a treatment option where we go in and we can place 2 to 4 implants, and we have a denture that now doesn't float and move around. Now that denture can click into those implants. And so it's something that's removable. It comes in and out. It does make it easy to go in and brush each implant individually, brushing and cleaning the denture individually. It's a lower investment level for somebody who may not be able to go to the fixed full arch, which is the fixed full arch is the option where you have anywhere from 4 to 6 implants, and we fixate a prosthesis. So we fixate the teeth into those implants, and they get screwed in and attached to them. So you don't take them in and out. Only the dentist can do that. And essentially, that's as close as we have gotten in dentistry to making something as lifelike and as natural as possible. It's the very best type of full arch treatment that you can have. When patients come in for a consultation, we look at everything as a whole. We want to check the stability of the existing teeth. Is it somebody suffering from periodontitis? So we look at the gum health. Gum disease plays a role. Infections. So if somebody comes in and for the most part their teeth are savable, we're going to talk about options to keep that, because we want to be as conservative as possible. And make no mistake, although this is a very nice treatment to replace teeth with a full arch with fixed implants, nothing is as good as what your natural teeth are going to be. So if somebody comes in and they just need general dentistry, some fillings, some crowns, we're going to try and restore that. If they're missing one tooth or they need to have a tooth here and there extracted, then we're talking about single implant treatment where we're replacing single teeth, single units, and then we're maintaining the remaining teeth as a whole. People who need a full arch of implants, where you and I talked about, whether it be a snap-in denture arch or a fixed full arch, those people are coming from situations where their existing teeth are no longer savable. We're not going to take out a bunch of healthy teeth just to put in implants. That ethically is not something that we would do. But normally people who are in this situation, whether through teeth breaking down, cavities, just infections, if overall the overall health of the teeth, you're no longer able to keep those teeth and you need a solution, then that's where we talk about the implant options to replace. I refer to it as terminal dentition. If they have teeth, those teeth that are terminal, we need to restart. And the best options are to consider the implant options. Here at our office, we have an option for everybody. So even if somebody can't do implants, but those teeth are in there, they're infected, they're causing issues with their oral health, we got to take those teeth out. So we'll take the teeth out, we'll make you the very best digital denture that can be made. It'll look really pretty. The function's not going to be amazing, but maybe you're somebody who, God willing, is fortunate enough to have enough bone to maybe in the future have some implants. And so there's always something to look forward to. Everyone's in different circumstances, and sometimes it has to be a denture, and we're going to make the very best denture that we can. And if you're fortunate enough to be able to consider the other treatment modalities, then we're going to address that as well. When patients come to our practice and they're looking at full arch options, they think they're buying a treatment. And you and I talked about this before. I want, this many implants. I want, the snap-in denture. I want the fixed. But really what that patient wants is a solution to the issues that they're having, which is they can't function right. They're in pain. They can't smile. They can't go to events. So it's our job to pinpoint what those pain points are and try to create a vision for that patient. What's most important to you? Is it aesthetics? On a level of 1 to 10, how important is aesthetics to you? Because that'll differentiate between the treatments. The zirconia is much more aesthetic than snap-in denture. Do you want something that you're going to put in and it's going to last 20, 30 years? Or do you want something that, it's going to require a little more maintenance, but is at a lower entry investment cost? The way I describe it too is what's more important to you in terms of function. Are you okay with something that comes in and out? Or is that a deal breaker for you? It has to be something it stays in, it doesn't come out. Those things are important when you're considering where you want to be in terms of investment level and in terms of creating the vision and understanding, okay, I can live with that. That's what I want. That's what I'm looking for. And because what you don't want to do is match a patient up with a treatment that is different than what their expectation is. So we have to align expectations and we have to align reality by being transparent on the front end. We talk about longevity. How important is that? Aesthetics, how important is that? We talk about functionality, how important is that? You're going to be able to eat different foods with a snap-in denture versus a fixed denture versus a traditional denture. That's just physics, it's just nature, right? You're not going to be able to eat anything you want with a traditional set of dentures. There are things that you're just not going to be able to eat. There's just not enough pressure and force to be able to do that. You'll then be able to enjoy certain things more with a denture that has some support from implants, but there's still some mobility there, right? Like I said, the fixed one is going to be the one that's going to be closest. Because we have patients come in all the time. I don't care how it looks. I just want to eat a giant juicy steak because I haven't been able to eat steak in 10 years with these dentures. And so it's like, well, then we're not going to talk about this treatment because that's not what you want. This is the one that's going to address that concern for you. So again, it goes back to, it's not a one size fits all. And you really have to find that meeting point and compromise with the patient where they can be financially. In our office, we offer a lot of different financial opportunities. Some people are fortunate enough to do those, some aren't. And so we really have to take one individual person as uniquely as they come. So the process for fixed full arch implants is pretty simple. So once you come in for your consultation, we'll discuss the treatment, we'll discuss the options. Once you're in agreement, we'll take several photographs, we'll take intraoral scans. And in our office, we do everything digitally. So before you even come in for surgery, we've already designed how we want your smile to look like before we even start. And that's very important because you want to be able to be confident that you're going to be able to deliver the smile that the patient's looking for. After the consultation appointment, we get scheduled for surgery. So on the day of surgery, you'll come in, we get everything nice and numb, the teeth come out, the implants go in, and for fixed full arch, we close everything up, we get scans of where our implants are, and then you get to go home for that day to rest. While my team, we will work very hard to design what's called the healing, the temporary PMMA is what the material is made of. So the temporary fixed arch that you'll heal with. So we'll bring you back in the next day for delivery. And the reason why is that way we can ensure that the quality of the temporary is to the highest standard. And so we have control over all of that. And so a patient comes in the next day, we check and see how they did, how they're doing. We deliver the fixed temporary arch, and they'll heal with that for about 3 to 6 months sometimes. When they come back after they've healed, we remove the temporary, we scan everything again, because at that point, your tissue, your bone, things will have changed and modified from the day of surgery. And so we want to account for that when we make that final prosthesis. And so we also want to account for any design changes that the patient might want. So, I want this tooth turned a little bit, or, I think I like that darker shade, but I think I want to go brighter now, or vice versa. So we make those tweaks at the follow-up after they've healed for 3 to 6 months. And then we move forward with making the final zirconia. So after we scan everything, we put the temporary back on, and then we start the process of either fabricating the final zirconia, or we'll do another temporary smile with those changes. If there's a lot of changes, we like to make those changes. We'll make a new temporary fixed arch. We'll deliver it, see how everything looks, scan that, and then once the patient has approved and the bite looks good, function looks good, then we move to process the final zirconia. So that's a pretty detailed overview of what to expect from this. Alternatively, when we're doing a snap-in denture case, there are some minor differences. On the day of consultation, it's very similarly, you will have photographs taken, scans taken, and we will plan for your surgery. The day you come in for your surgery, we place those implants, we close everything up, and we have a set of temporary healing dentures that you'll wear for a period of 3 to 6 months. The biggest difference between snap-in dentures and the fixed arch prosthesis is that you'll be healing with a traditional denture, in the sense that it's going to sit on your gums and we're going to show you how to use adhesives. With those treatments, we have to bury the implants underneath the gums for them to heal for a certain amount of time. After the 3 to 6 month healing process, we bring the patient back in, we uncover the implants, make sure everything's integrated, everything looks good, and we begin the process to make that final denture that's going to be snapping in and out.